Well, South Africa has the biggest and most high-profile HIV epidemic in the world, with an estimated 7.7 million people living with HIV in 2018. We also account for a third of all new HIV infections in southern Africa. Young people are bearing the brunt of the pandemic, and UNAIDS says they're particularly susceptible to HIV infections, and they also carry the burden of caring for family members who are living with HIV/AIDS. To discuss whether South Africa's AIDS policies have been effective, we're joined by Dr Ndiviwe Mphothulo. He is the executive member of the Rural Doctors Association of South Africa. Dr Ndiviwe, good evening, and thank you so much for your time tonight. I think maybe before we get into some of the more specific questions, your reflections as we mark World AIDS Day and what this means for you as a clinician.
Good evening, Eddie, and good evening to the viewers as well. And this year is World AIDS Day is actually a different World AIDS Day because we have a situation of COVID-19, which is threatening the progress that the world and South Africa has made over the past 20 years in the fight against HIV. But looking at the positive aspects, I think South Africa has done extremely well. If you can look where we were at 20 years ago and where we are now, looking at how we've increased the life expectancy, looking at if you look at the 90 targets, I mean, we're doing well, where we've got almost 90% of people who are HIV positive knowing the HIV status. In the second 90, we have 90% of our people, where we say 90% of the people who are on HIV treatment to have sustained a viral suppression. So we are doing quite well, even though there are some challenges.
And let's talk about some of the challenges that you face specifically, and that your doctors or your members would face working in some of the rural parts of the country.
Okay. Rural areas face different challenges compared to your urban areas. You find that, in rural areas, because it's small, close-knit families and small, close-knit communities, you find that works against us in terms of the stigma. You find that there's problem of stigma due to that. And you find that there's low level of HIV awareness in rural communities compared to your urban areas. And then again, in terms of the human resource challenges, as you know, that South Africa has about a 42% rural community, but only has 19% of doctors working in rural areas and about 25% of nurses. So that means colleagues working in rural areas have a problem of being overworked and having little resources.
Does that also mean that if you are somebody who's living with HIV in a rural area, you're less likely to get adequate treatment for the virus than somebody else who's perhaps living in an urban area where the resources are slightly more?
Yes, definitely. If you look at the rural areas, you must look at the patient. There will be patient factors. There'll be factors about the society. There'll be health-related factors. Now, patients in rural areas struggle for access. There's an access problem where it is difficult for them to get to a health facility compared to someone who's in an urban area. But what the government has done well in terms of once you're at the health facility, I would say the quality of care in a rural facility would be similar to quality of care in an urban area. But the problem will then be access. So our people in rural areas struggle to get to these facilities. But once they're in the facilities, I think the quality of treatment is good.
Why are there such low levels of awareness of HIV in these areas? What do you think the problem there might be?
I would think because you remember when the HIV started, it was like an urban disease. So most of the campaigns were focused in urban areas, and I think it took time for the campaigns to get to rural areas, and most of your HIV was in your urban areas. So it took long for for these campaigns to get to rural areas. And I think another problem, what we must understand is that the situation in rural areas and urban areas is different. In rural areas, you need, the language is important. The messaging should be made to be in languages that people understand. And the traditional leaders in rural areas play a very important role. So I think we should be including them more. And we know most of our patients in rural areas also attend traditional healers. So I think those are the areas we've neglected, the use of traditional healers and traditional leaders.
These sound like simple things to do, and the reality is that even though there may have been different types of focuses that were put depending on where in the country you were. We've been fighting HIV/AIDS for a long time now. It's years on. Surely it cannot be enough that that there are still people who are living with a lack of information. Do you think that would change if the access to primary health care in rural areas was improved in general, so that it is perhaps not just an HIV issue, but it rather also has to do with the fact that there's very little access to any other types of healthcare for rural communities?
Yes, definitely. I agree with you, Kathy. The major problem is I think rural areas have never had a lot of primary health facilities. So we've had a situation where we've got a hospital-based healthcare, which neglects the primary healthcare. So you need to also improve your primary healthcare facilities, access to your primary healthcare facilities. But again, we saw from COVID-19, that one of the most important things you do in fighting COVID-19 is behavior change. So I think maybe we have been focusing mostly on the scientific part, and more on the hospital and the clinic part, but we have missed the importance of involving the communities and telling them how behavior change can assist us in the fight against HIV.
So effectively, it's not just what government or different agencies are saying, but it's where they're saying it and how they're saying it.
Definitely. I think also myself from medical school, I think we've been taught to that patient comes to you, you treat the patient goes home, and we are told that South Africa produces some of the best doctors in the world, but we are not seeing the outcomes. I think there is a gap there in global health that we've ignored the community. So I think the fight is not at the clinic or at the hospital. The fight is at the community. I think that's what we should recognize in the fight against HIV, as we have recognized in the fight against COVID, that the fight is not at the hospital, it's at the community level.
Dr. Ndiviwe Mphothulo, let me thank you so much for your time tonight. He is the Deputy President of the South African HIV Clinician Society and Executive Member of the Rural Doctors Association.